on cardiovascular system. So serotonin is a powerful vasoconstrictor except in skeletal muscle and heart muscles. Heart or skeletal muscle में serotonin causes dilation, while other muscle में serotonin cause contraction. But one thing we should be kept in mind that serotonin induce vasodilation. Serotonin induce vasodilation needs the vascular endothelial cells, because these vascular endothelial cells, they releasing EDRF or nitrous oxide, which are vasodilated. Okay, this is the blood vessel. इसमें ये intact normal endothelial cells है, और ये endothelial cells releasing nitrous oxide, prostaglandin E2, which are inhibitory and both causes dilation. So when endothelial cells are damaged, no nitrous oxide or EDRF is released. So this condition, this damaged endothelial cells will cause coronary vasoconstriction. And this, once there is the bleeding phenomena, during bleeding phenomena, the damaged platelets releasing serotonin, and serotonin cause contraction, and that this is the natural mechanism of this is the natural anti-bleeding mechanism, the release of serotonin from platelets. There is a triple triphasic blood pressure response of serotonin. The IV injection of serotonin producing triphasic BP response. This is phase number 1. In phase 1, there is vasodilation due to BJR, Bezol-Jares reflex. Due to this chemoreflex, BJR, this decreased heart rate, decreased blood pressure, decreased cardiac output, decreased force of contraction. So BP is going down. In the second phase, serotonin producing increased vasoconstriction in the artery and venous vessels, and this contraction is responsible for increased blood pressure. So this is the increased blood pressure. This is the second phase. First phase, decline of blood pressure. Second phase, increasing blood pressure. And third phase, due to vasodilation in vessels which supply blood to the skeletal muscle. तो वो वेसल जो स्केलेटल मसल को ब्लड सप्लाई करते हैं, उसमें वेसोडाइलेशन, तो देयर इज अगेन डिक्लाइन ऑफ ब्लड प्रेशर. फर्स्ट फेज डिक्लाइन ऑफ ब्लड प्रेशर, सेकंड फेज shoot up of blood pressure, and third phase again decline of blood pressure. This is due to this first phase decline in blood pressure is due to BJR reflux, and this second is due to vasodilation in skeletal vessels supply. Skeletal is due to vasodilation in vessel which supplies blood to the skeletal muscles. Serotonin causes vasoconstriction in veins. This constriction is responsible for increased filling of capillaries, and once the capillaries are filled, there is flushing phenomena. The prolonged elevated serotonin level is also responsible for the alteration, changing of endocardium, and this change endocardium is responsible for valvular and electrical dysfunction of the heart. Moreover, 5-HT are also responsible for platelet aggregation. Number next is effect on GIT. This in the GIT there are 5-HT2 and 4, 5-HT2 and 4, 2 is GQ and 4 is GS receptors. Once 5-HT cisapride, leopride, domperidone bind here and stimulate this receptor after intracellular signaling, increasing intracellular calcium. This increased intracellular calcium causes contraction. This contraction is responsible for prokinetic action. This contraction is also responsible for diarrhea. And this contraction, this increased calcium is also responsible for increased release of neurotransmitter. In carcinoid patient, remember there will be diarrhea, because in carcinoid patient there will be increased concentration of serotonin. There is another term, serotonin syndrome. Serotonin syndrome is precipitated when when monoamine oxidase inhibitors are given with 5-HT agonist, so especially SSRI. Appetite control with serotonin, as serotonin is related to sleep, emotion, sex, appetite. So studies suggest that 5-HT can reduce food intake in animal as anorexic agent, reduce food intake and for the reduction of weight. So for this purpose, a drug was designed, fenfluramine. This was the racemic mixture, racemate. This was the racemate, mean ke L and dex form, and this drug was closely related to amphetamine, but the dextro form of fenfluramine was twice potent than lev form. So dexfenfluramine was the best selling drug in US when it was released for the weight reducing activity and for anorexic purpose. Inhibitory release and reuptake as well as stimulate 5-HT receptors. This dexfenfluramine is this drug inhibiting release of 5-HT and inhibiting reuptake of the 5-HT and stimulate 5-HT receptor. That's why this cause anorexia. While the cyproheptadine inhibiting this 5-HT, and that's why that is appetizer. The adverse effect related to this drug were pulmonary hypertension and valvular dysfunction. Thank you for listening.